Namaste, this is Dr.VijayaLakshmi from Vijaya Dental. We have branches at Chikadpalli and Kajaguda. I am having experience about 23 years in this dentistry. And today I am going to tell about the wisdom teeth problems, what to do, what not to do when you get this wisdom tooth. It's coming. So generally the most common question about the people is, they ask me, whenever they get the wisdom tooth pain or the problem, is it necessary to remove it or not? No, I will say no. Until and unless it troubles you, don't trouble the tooth. There are the common consequences while coming the wisdom tooth at the age of, it starts at the age of 17 years till 70 years. It's not like anytime it can try to come out. Some people will be having a very narrow arch, like arch will be very small like this. So in that cases, the tooth will not come out properly. So it will be like stuck inside the gums. So whenever it is erupting, like it's called eruptive forces, so that time they might get a slight pain kind of thing, and sometimes they'll having a slight bulge over the tooth, that's called as gum swelling. It will be, we call it as pericoronitis. So that time they might have the pain in the gums or the pain in the teeth. The simple medication will solve the problem. So I never advise go for removal, no, never, because natural teeth, it has to be there. That's one thing. The second thing is, whenever there is a gum inflammation or the upper tooth is touching the over the lower teeth, then slightly we can do something called as whenever there is a pericoronitis, we call it as operculectomy. Like we'll just cut the gums thoroughly, we can just give the clearance so that the tooth will come out properly. In some cases, the tooth will not be in the straight, it will be in the cross. So that case, it might, the foot can get stuck between the two teeth, there will be a cavity to the adjacent tooth. So that has to be cleared actually. So whenever you feel such kind of things, so do brushing properly in that area, do gargle properly, either with a normal salt water, or the normal water will do the solve the problem in that case. And most common, the thing that people will do is, they apply some balms outside, or they apply the hot packs, which is really not, should never do that actually. Because whenever you apply this hot pack, or whenever you apply the balm over the skin like this, so it might increase the pain, and the swelling might increase. So never do that. Please consult your dentist, consult your nearby dentist, so they can give a preferable antibiotic or the painkillers. They can see like what is the best thing, and we should take one X-ray and see whether it is really damaging the adjacent tooth or not. If it is mandatory only, you should go for the removal of the tooth, otherwise no need at all. And some people will ask, like, only 17 years do they get this wisdom tooth? No, sometimes at the age of even 40-50 years also it might be seen, but it is not affecting that. But because of wisdom tooth, the adjacent tooth is becoming cavity, so that has to be careful, and that will be made out very clearly, while eating, whenever they chew the food, the foods will get stuck over there. They can use the toothpick and they will be using the pin. That is the first indication, like you have got a cavity or you have got some problem over there. So in that case, if you visit a dentist, you can just normally go for a normal simple filling. That's a better way to avoid this removal of the wisdom tooth. So not all wisdom tooth will go for the removal, and please never do that. And this generally some people will ask me, like, for males or females, is there any differentiation? No, nothing like that. 17 years, anybody can get this problem. So never think. And many people will ask me, like, does it really a painful procedure to remove the tooth? No, generally upper teeth is really very easy to remove, but very 10% of cases will be a bit tough actually. So that will be made out in the X-ray only, whether it's a easy removal or not. But sometimes we think it's a very easy procedure, because we take X-ray, it's a 2-dimensional, it will be like this. We don't know exactly outside how it is. So it might be sometimes tough also, depending on the patient cooperation, depending on the doctor, it will be there, and whatever. So not always wisdom tooth removal is mandatory. One more thing I want to add for this is, many people will think if they go for the removal of wisdom tooth, they lose the wisdom. No, it's never. See, the wisdom tooth are coming after 17 years, right? So until unless you will be having a wisdom. So earlier they used to tell like that, because the people maturity, the person will get around 17 years. So that's the reason they kept his wisdom tooth. So it's never like, you will be connected to the brain basically, not with the teeth. So never think like if you go for removal of teeth, you will be losing your wisdom, you will be losing your knowledge, nothing like that. So if you have problem, yes, it has to be removed. If there is no problem, don't go for removal of the wisdom tooth. So this is about the wisdom tooth problem, and what you should do, we should not do. Thank you for watching this video. Thank you so much.